is Catherine de Fontenay. I'm a commissioner at the Productivity Commission. The Productivity Commission is an independent commission that's part of the federal government. So we work on a broad range of topics, some of which include health. So we did a big inquiry into mental health a couple of years ago. The normal way of looking at health productivity is to look at the product of the health system as a hospital visit or a visit to the GP. That's a problem because you can only get productivity improvements if you reduce the cost of a visit, maybe a shorter stay in hospital. But what we're really trying to produce is health. So what we did in this report is we looked at the productivity of healthcare. For example, if you have lung cancer, what's happening to outcomes, and can you be treated perhaps in a lower cost setting such as your home? So when we frame it in those terms, what is the productivity of health treatment? We see that we get a 3% increase per year in productivity. So that's really exciting. That means health outcomes have been improving and we're getting better value for our money. Our report showed that the productivity of health treatments is improving, which is exciting. But we're still not looking at what are the factors that cause people to become sick in the first place. Australia has very high rates of obesity and high rates of alcohol consumption. If we address those factors, we can significantly reduce the cost of the healthcare system as a whole. We've also identified other ways that we can reduce healthcare costs. In particular, we think that digital technologies have a lot of promise in terms of their ability to reduce excess testing and to deliver care in lower cost settings. Australia, when we just look at their healthcare spend and our health outcomes, looks pretty middle of the road. But that's before we control for health risks in the population. Australia has a very high rate of obesity and high rates of alcohol consumption. On the other hand, our population's a bit younger than other countries. So when we make adjustments for those risk factors, what we find is that Australia is actually third in the world in a comparison set of 28 comparable high-income countries. So that's really exciting. That says we're getting very good value for money from what we spend on healthcare. It's very costly to the quality of patient care not to have good electronic medical records. For example, we found that medication-related errors cost about $1.4 billion a year, and about half of that is preventable with better record keeping. So that's very costly to the individuals and costly to the system. We also found that there's a lot of duplication of tests. And we found that when people are discharged from hospital, if their GP doesn't get a good electronic discharge or a good paper discharge, the risk of readmission goes up by 79%. So we think those are two really important areas to focus on: medication records and electronic medical discharges from hospital. Our report looks at leveraging digital technologies in healthcare. We think that there's huge potential for technologies to make a big difference to our healthcare system. That's electronic medical records, telehealth, which is already having a big impact, remote care, that includes remote monitoring and digital therapeutics, and artificial intelligence. But aside from telehealth, we think those technologies are not having quite as much impact as they could if we were using them effectively. There is already a lot of evidence that these technologies could make a big difference. So hospitals that are using electronic medical records effectively have found that their testing costs have gone way down because they're reducing duplication in tests by 6% to 12%, depending on the test. There's also fewer errors in treatment. For instance, specialists can supervise and look at a patient's record remotely, for example. We've also found in studies that technologies such as remote monitoring of patients with diabetes, particularly high-risk patients, can really reduce the risk of complications. We're not getting quite as much benefit from technologies such as remote monitoring or digital therapeutics that we could if we had better suited funding structures. So remote monitoring, for example, monitoring the insulin levels of a high-risk patient who has diabetes, that's funded for type 1 patients, but it's not funded for type 2 patients, even patients who are at significant risk of complication. Broadly speaking, there's a few small areas where funding exists for remote monitoring, but a lot of other areas don't fall in our normal funding buckets. And so we think that that needs a closer look. We think the potential for these technologies to save costs is huge. For example, we've estimated that hospitals could save about $5 billion in terms of reducing duplication in tests and speeding up the discharge of patients. So that's already very significant. The OECD has estimated that about a third of healthcare worker time could be saved by artificial intelligence and related technologies. So that's extraordinary. When we think about the aging of our population and the demands that we're going to have on our health system, freeing up healthcare workers' time to deliver better care and to deliver care to more people, that's going to be absolutely vital.